Hello everyone. Because of the time limitation, we have to start our presentation now. So everyone, please just feel free to grab your food while the presentation. I'd like to introduce a little bit about Jenna and I. So we met each other for the student insurance committee, and we are the only two graduate students in this insurance committee. Every year they will have a meeting to discuss the insurance policies and student issues. So that's like when we realized there are like so many issues or questions from graduate students. And then we started to work really hard on that. So first thing is that we developed a student resource documentation. I believe you already got that from the graduate student letter, or you can still scan this QR code to get this information. And the second thing we did is like create a student insurance survey to collect all the student feedback about their problems, questions, and then that's how we plan for this information session. So hope this session helped you to know more about how to utilize your student insurance. And then the next thing is Jenna worked really hard on is that she gathered a lot of resources that student insurance department may not be able to provide because of conflict of interest. So she will share the tips on how to avoid unexpected bills and some resources about dental and visual resources in Auburn or close to Auburn. And she is the, by the way, she is the last year PhD student from Department of Pharmacy. So really appreciate her efforts on all of these things. Without her help, this won't be even happen, I think. So, by the way, my name is Cassie, and I'm the outgoing Vice President of Student Affairs from Graduate Student Council. And hopefully this event will be continued, and Beijia will be the next year's Vice President of Student Affairs. And hope if you have any feedbacks from this session, please let us know. Get connect with GSC, and we will do our best to get this information better and better. Thank you.
Thank you, Cassie, for the introduction. And Cassie has also spent numerous hours working on this and helping it happen. So thank you so much, Cassie. So just to give a little background, I first got kind of interested in the student insurance when a year ago my boyfriend tore his ACL. So before then, I had never looked at the insurance policy, never read it. I've had it for 2 years, but I've never really used it that much. And once we started having some issues with that, having some unexpected bills, I started talking to other students, and I realized that a lot of students are having similar problems. So that's one of the things that prompted this. And we hope that this session can just allow us to share some tips to each other so that we're not overspending and we're hopefully saving money. So if anyone has a question or a comment during the presentation, please feel free to interrupt me. And if there's a question that I can't answer, maybe there's somebody in the audience who has experience with that issue and might be able to answer your question. So I think a lot of you already saw there are some resources on the back table. I'm not sure if any of those are left, but if they're gone, you can scan the QR code. It's here, it's in the back of the room, and there should also be some sheets of paper in the back. You can just scan that, and you'll have access to all the documents from today, including this presentation. So I'm just going to go through 10 tips to hopefully help you prevent unexpected bills. So the first one is just remember to always get a referral from AUMC whenever you see a specialist. So this includes any specialty areas such as dermatology, endocrinology, oncology, ear, nose, and throat, etc. In our plan, it says that a referral is not required for maternity, obstetrical care, or gynecology, but we have heard of issues from students having their bills or claims denied after seeing that. So it might be a good idea just to call AUMC and talk to them about it before you go to the provider, just to see what they say about your need for a referral. The other thing to keep in mind is that the referral is not necessary when you're more than 50 miles away from campus. So I know we have some distance students or students that live in other places. You just need to make sure that you're actually 50 miles or farther away before you see that specialist. And that's just because if the student lives like hundreds of miles away, then they might not have access to AUMC. So the referral that you get from AUMC will have a specific diagnostic code. So for example, if you have diabetes and you see an endocrinologist, that referral will have a code for diabetes on it. When you see the specialist, that specialist has to use the same diagnosis code that your primary physician did. So if they start treating you for something else, like kidney disease, and they use a different diagnosis code, you have to go back and get that referral from AUMC. You might be able to call them and ask them for it to avoid making an appointment, but that's kind of up to them. And you do also need to get a new referral for each new benefit period. So that period usually ends on August 15th. So even if you're already seeing the specialist, you're seeing them August, July, or you're seeing them June and July, and then you start seeing them in August, you need to make sure that you have an updated referral. Are there any questions about the referral process? Okay, the next step is just trying to avoid out-of-network facilities and physicians when possible. So this is in the plan. So there is a deductible specifically for in-network, which is $250. So that would be anytime that you're not going to AUMC, you would first need to pay that deductible before the insurance company starts paying. And then if you see an out-of-network provider, it's actually $500 for the deductible. And if you already paid your deductible for an in-network provider and then you go out-of-network, that money starts over. So you have to pay $500. You don't have to pay just $250 or the extra amount. So that's really important to keep in mind. And there are also limits to the amount that you pay if you need to go in network. So say you have some really expensive procedure or you have something unexpected happen, there is a limit of the amount that you would have to pay, around $7,000 if they're in network, but if they're out of network, there's no limit. And finally, the co-insurance is also different for in-network versus out-of-network. For in-network providers, the insurance will cover 80% after your deductible. For out-of-network, it's only 60%. So that's a pretty big difference as well. So how do you know whether or not the provider is in-network? You can check online through your UHCSR account. So that's something that I would suggest that everyone makes an account, and to be familiar with that process, there's a link where you can click and search for in-network providers. Other important thing, just because the facility is in-network doesn't mean that all the services provided there are also in-network. So specifically, there are certain specialists that are kind of their own entities or separate from the hospital or facility. That includes anesthesiologists, radiologists, emergency medicine, and pathology. So this is important because at this time, none of the anesthesiologists or radiologists at EAMC are in network. If you were here for the previous session, they did tell us that starting in fall 2019, they will cover the anesthesiologists and radiologists at in-network benefits. But until then, they're still considered out of network. So that's just something to be aware of. If you need that care, you're probably going to get a pretty big bill. Any questions about in-network versus out of network? Or how to figure that out? Okay. So the next thing, this has been discussed previously, so there are some conditions or treatments that are not covered with UHCSR. This is just a couple of them. There is a complete list inside the insurance policy. So that includes things like acne or skin conditions. They won't cover those at all. So that means if you go to the doctor and they put acne as the diagnosis code, that visit's not going to be covered at all. Any medication is not going to be covered at all by the insurance. You'll be paying 100% of that. Other things that are not covered include hair loss or excessive hair, weight loss treatment, fertility treatment, certain jaw conditions, deviated nasal septum. And this is another important one. Injuries sustained during certain activities are not covered. So that includes if you participate in any intercollegiate or professional sport, including practicing for those or traveling to or from those. So that means if you are on some kind of club team at Auburn University and you're playing against other colleges, they will not cover you if you get injured during that. Which is kind of crazy, but keep that in mind. And the way that they find that out is they actually ask you to submit an accident report online if you have that kind of injury. So for example, I mentioned that my boyfriend tore his ACL playing soccer. He was playing intramural sports at the time, so luckily that was covered because it wasn't intercollegiate, meaning against a different university. But if he had been playing for a club soccer team during a practice or something like that, they could deny his claim. So just know that whatever you report to the insurance company, they're using to decide whether or not to cover your claim. Any questions on that? The next tip. So not all tests and lab work recommended by your doctor are covered by UHCSR. So for example, I've heard of instances where females have gone for their annual wellness visit and the doctor has recommended that they get screened for certain sexually transmitted diseases. And then of course they say yes because the doctor recommended it, so they think it's something that they should do. But then the insurance company denies that claim because it's something that's not covered. So it's important to realize that not everything that your doctor recommends is going to be covered. If you're able to, you can ask the doctor, okay, what do you think I should do? And you can call the insurance company and see if it's going to be covered. That does take a lot of time, so it's not recommended if you have some kind of acute condition where you need medical care right away. But if it's something that can wait, you could consider, just asking them, hey, what do you think what tests do you think I need to get done? And then you can just make sure it's covered under your policy. So the next tip is always double check your explanation of benefits and facility bill for accuracy. So a lot of times there are mistakes on these, and it's important to kind of understand the process of how it's done as well as read one of your explanation of benefits. So it helps to think about how the billing process actually works. So usually you'll go to a physician and you'll receive some kind of medical care. They might ask you to pay a copay or pay upfront for certain services. So next, the facility will send the bill, which is called the claim, to your insurance company. And that claim will have your diagnostic codes, so anything that they treated while you were there, as well as the billing code, so any services they provided while you were there. And this is when they could also send other documentation, such as a referral. So they send all of that to the insurance company. Then the insurance company evaluates the claim and they determine how much they're going to cover based on your insurance plan. So they have the bill, they have your plan, they compare the two, and they say, okay, this is how much we're going to pay. The next step is that the insurance company sends a check for the amount of the bill that they will cover and the explanation of benefits to that facility. And you'll also be able to access the explanation of benefits online. So finally, after all of this process is over, the facility finally will send you a bill for the remaining cost of the services. So this can take some time. It usually takes at least a couple of weeks. And until then, you might not know what you have to pay. So that can be a little bit frustrating, going to the doctor and then, just having to wait and see how much they're charging you for. So this is an example of an explanation of benefits. So this is something that you can access online through your UHCSR account, and it'll show up under explanation of benefits. So this example was for a MRI. This is the service that was provided. It also tells you the date of the service, so you can make sure that what they're billing you for is actually the correct day that you received the service. There'll also be a code associated with that service, so this code should match the MRI. Next is this amount claimed. So this is the total cost of services that you received. So in this case, the place that provided the MRI is saying, okay, it's costing us $1,628 to provide this service to the patient. So next you'll see a discount if it's an in-network provider. So if it's in-network, that means that the facility or the physician negotiated with UHCSR to give you a discounted rate, and that's why you would see a discount here. So then the total covered would be the amount claimed minus the discount. So that's the amount that's actually being asked for by the facility at this point. So next, you break it down into what you pay and what the insurance company pays. So the policy deductible, this one was $136. So that means that was the remaining amount of the deductible which the patient has to pay. So since it was in-network, the total deductible for the year is $250. That means that they've already paid around $120. This is just the remaining amount on the deductible. So next we have the total benefits. So that's the amount actually paid by the insurance. So in this example, it should be the total covered minus the deductible, and then the insurance should pay 80% of whatever is left. And then the patient balance would be that deductible plus the remaining 20%, which wasn't covered. And this isn't actually your bill. This is just what the insurance is saying. Okay, this is the total amount that you should owe. But you might have already paid some money at the facility. So when you get the bill from the facility, they should subtract out whatever you already paid. Are there any questions about that? Yes, in the back.
I think that $136.3. That's so we maximum of $250 in a year. So if these are like over that 250, this column will be 0. So we don't need to pay anything.
So the question is about the deductible and kind of how much you pay after you meet the deductible. Is that correct? Okay, so after you've paid $250 towards the deductible, that's when your co-insurance applies. So at that point, if you're seeing an in-network provider, the insurance is paying 80% of the remaining bill and you're paying 20% of the remaining bill. So once you've met your deductible, you have met that deductible until the policy ends after a year. Does that make sense? Okay. Any other questions? And at this point, if you went to an out-of-network provider now, you would have to, again, pay $500 for the deductible, and then the insurance would only pay 60% of the cost. So that's why you want to stay in network as much as possible. Okay, so why to check this? Well, many medical bills contain errors. There have been studies done that up to 50% of these bills actually contain errors. So it's really important to check this on your own and make sure, okay, they're saying that I received this service. Well, did I really receive this service? Because they can make mistakes too. And it's also important to keep up with, how much you've already spent towards your deductible and just kind of double check their math and make sure that they're not underpaying what they should be paying. And it's also a good idea to regularly check your online account to see if the insurance company have sent you any messages. For example, if you have like a torn ACL, they're going to ask for an accident report, so like a report of what happened. And until you send that to them, they're not going to do anything. They're not going to cover anything. So it's important to check that and just make sure you're up to date for whatever messages they've sent you. So the next tip is that whenever you speak with an insurance company or the billing office or really anyone that has to do with your insurance and billing, it's always a good idea to document that interaction. So that includes the date, the time, the person's name, who you're speaking with, the reason for the call, and the answer you received. And that's just because, you know, sometimes if you call a facility more than once, you might not always talk to the same person. So it's helpful if you can say like, okay, I talked to this person at this time and they told me this. So at least if there's some kind of discrepancy in the information that they're giving you, you have that kind of proof that this is what the person told me before. So it's just helpful to document the interactions. And you can also try to ask for the person's direct phone extension so that you're not explaining your problem over and over and over again to different people. They might not do it, but it doesn't hurt to ask, just to try to keep that, not take so much time. Next tip is to shop around for the best price on prescription medications. So it was mentioned previously that the prescription medications are put in certain tiers based on their cost. And with the UHCSR insurance, there are 3 different tiers. And if you get the prescription at the AUMC pharmacy, it's less expensive than what you'll be billed if you get it from another pharmacy, such as Walgreens or CVS or Walmart, etc. So for tier 1 medications, it's $10 for a 31-day supply at AUMC versus $20 at other pharmacies. Tier 2 is $45 for a 31-day supply versus $60, and tier 3 is $75 versus $90. You can also keep in mind that birth control medications and contraceptives are supposed to be covered 100% by insurance plans based on like the Obamacare laws that came into place. So if all you're getting is birth control, you should be able to get it for free from any pharmacy. That includes AUMC, CVS, Walgreens, etc., the whole list. Oh, and you might be wondering how, oh, I have a question back.
I just want to make a comment. Actually, I just recently found out that Publix pharmacy, there are certain like antibiotics and other things. They have a whole list. If you go by their pharmacy, they've got a little pamphlet that are actually free.
Thank you. That's a great intro to my next slide. So, some pharmacies actually offer cost savings on common prescription medications. So in these cases, they might be offering even a lower price than what you would pay at AUMC. And this is not being run through your insurance. It's just like the Walgreens or the Publix itself is offering this discounted price. So it won't be processed on your insurance, but you can still get it at a low price. And we did have some handouts with the prescription medication saving plans in the back. I'm not sure if there's any left, but again, you can scan that QR code and get access to those documents. And I think we can also send them out maybe to all graduate students at the end. So this includes Walmart, Target, Winn-Dixie Pharmacy. They all have lists of medications that are available for $4 for a 30-day supply or $10 for a 90-day supply. And this would be things that are more common like blood pressure medications, some diabetes medications. They also have antidepressants on the list. There's a lot of different things. And like Elizabeth said, Publix actually offers some medications for free. It just includes some blood pressure medications, diabetes, and certain antibiotics. So you can literally go in, bring in your prescription for the medication, and you don't have to pay anything. And Publix also has a $7.50 for 90-day supply list of medications. So those are really good to know about as a way to save money. I have a question in the back.
Yeah, one of the things just to consider, I know a lot of physicians now, I don't know if AUMC does, they use an online submission for prescriptions. And so if you're wanting to possibly use an alternative, it might be good to request a written prescription because usually they ask you, what pharmacy do you use? So if you're not sure what pharmacy you want to go to, that's probably a good idea to keep that in mind.
That's a good point. So for those of you listening on Zoom, we had a comment from the audience that AUMC and a lot of the other physicians' office send prescriptions electronically to the pharmacy. So you might be able to ask them for a written prescription instead of the electronic prescription so that you have that with you and you can actually go to the pharmacy of your choice, say after you check maybe the list to see what would be the cheapest price. So that's a good suggestion. And even if they send it electronically, you can also call the pharmacy that they sent it to and ask them to transfer it to a different pharmacy. So that's also an option. Any other questions or comments? Okay, the next tip is to use the free telehealth services through UHCSR when possible. So this was discussed a little bit before. Telehealth just means the delivery of health services through audio or video calls. So instead of actually going to the doctor's office, you can do it from your phone or your laptop or something like that. So there are 2 telehealth services which are completely free through UHCSR. The first one is called Healthiest You. The second one is called Better Health. So with Healthiest You, it's just a general doctor access. It's available 24/7, and it's especially helpful for minor illnesses such as allergies, sore throat, earache, pink eye, etc. So just smaller things where the doctor maybe doesn't have to see you in person to evaluate you. It can be really good to use the services. And with Healthiest You, the doctor can even prescribe medications, which saves you a trip to the doctor's office. So I have actually used Healthiest You before, and it's really convenient. You can access it online through your UHCSR account, and on your insurance card, there should also be the phone number and the website for the service as well. So when I used it, I had a sore throat. And you just go through a process where they ask you to fill out, okay, what kind of problems are you having? They even let you upload like pictures to it. So I took a picture of my throat and uploaded it to the service. And then after about 30 minutes, the physician called me and she said, you know, based on your symptoms, it sounds like you might have strep throat. I'm going to send an antibiotic to the pharmacy for you to pick up. So it was super easy and I didn't pay anything. And then BetterHelp is a counseling service. We have heard that it's very difficult to get into the mental health providers at AUMC. So this is one option where you can talk to counselors online. And you can do that through video calls, audio calls, or just chatting like a text message service. The only limitation there is those providers that you see cannot prescribe medications for mental health, but they can talk to you. Any questions about either of those services? In the back.
So just to verify, because in the last session they said we can only use these services when the med clinic is not open. Is that correct?
So I have used Healthiest You when the med clinic is open. I did not get any bill for the service. Any further questions? So I really liked Healthiest You. It was a good experience. And it's also kind of a nice way to see like, hey, do I really need to see the doctor in person or can this just be handled, you know, over the phone? So I think it's a really great service. Are there any other questions? Okay, the next tip is to consider obtaining dental or vision insurance, but first kind of think about the costs and the benefits. So dental services are expensive. These are some of the average out-of-pocket costs for various services without insurance. And then the average cost of dental insurance premiums are about $15 to $30 per month, depending on what kind of coverage you opt for. And that translates to about $180 to $360 per year. When UHCSR was in here, she said theirs is $200 a month, which is really high, and I wonder if that's true. But there are some handouts about some of the different dental services or insurance companies and their costs and benefits in the back if there's still some left. Otherwise, again, you can access those online. So most of your dental insurance will cover free cleanings and x-rays. So the cleanings twice a year and the x-rays at least once a year. But they might not pay that much for other services. So a lot of them only pay about 50% or less for some of the other services that you see on the screen. And a lot of them also have waiting periods. So they say you have to wait 180 days before we'll cover this service, or you'll have to wait 360 days before we cover this other service. And that's because I guess they don't want people just signing up for the insurance when they have a problem and need something fixed. They want people to sign up and just have it in case something happens. So it's important to, look at that on the dental plans, especially if you have an issue that needs to be fixed right away. Just know that they might not cover it until after a certain waiting period. So I just want to give some examples for scenarios of cost with and without dental insurance. So for these, I just use Blue Cross Blue Shield Dental Blue, which is one of the services available in our area. So if you get that insurance service, you'll pay about $21 for your monthly premium, and you'll have about a $50 deductible. So again, that's how much you have to pay before they start paying. So let's say this is somebody that doesn't use their dental insurance very much. They just use it for their cleanings and to get an x-ray once a year. So based on the cost that we mentioned previously for the averages for 2 cleanings and an x-ray, it might cost about $275 for that year. So their total cost is $275. Whereas the person that gets the insurance, they have this premium, they have this deductible, but then they don't have to pay for their cleaning and x-ray except for this deductible. Their total cost would be about $302 a year. So in that scenario, it's about equal, but the person does end up paying more with the dental insurance. So this is another example scenario for somebody that maybe uses their dental insurance a little bit more. So again, I just chose the Blue Cross Blue Shield Dental Blue, and I show that there. So this person, they had to get the 2 cleanings and 1 x-ray, but then they also had a cavity filling and a tooth extraction. Well, this plan covers 75% of the cavity cost, but it's only after 180 days. So say this person had a cavity filled maybe 90 days into their insurance. They still end up paying that full $200 because they haven't reached the 180 days mark. But then let's say they need a tooth extracted, and that one is after 180 days. So the insurance covers 75% and they pay $50. So in this scenario, the person with no insurance paid $675 for the year. The person with insurance paid $552. So that's just one example of a scenario with and without insurance. A lot of people don't have dental insurance just because a lot of times you don't necessarily save that much money with it. So some people just prefer to take the chance without it. Personally, I don't have dental insurance. So if something comes up, I might be paying more, but I don't have to pay that monthly premium. So there are also discounted dental services available for people without insurance. So a lot of the dental hygienist schools offer cleanings and x-rays at very discounted rates. Unfortunately, we don't have a dental hygienist school in Auburn. The closest one I could find is in Columbus, Georgia. And they offer adult cleanings, x-rays, and fluoride for $30. And we did have some brochures in the back from them with more descriptions of their services, and it's also available online. So I'm actually planning on signing up for one of their $30 appointments. But the person that I talked to in charge of their program did say, like, okay, it is a student doing the work on you, so it might take a little more time, and just those sort of things to keep in mind, that it would be a student doing the cleaning service. There are also some community health centers that offer income-based discounts on dental services. So these are 2 close by that I was able to find. One is the Tuskegee Quality Health Center, and one is the Susie E. Allen Health Center. So nothing in Auburn, but these aren't too far away. And I don't have any personal experience with either of these, but online it says that they take what your income is, you have to provide some kind of documentation, and then based on your income, they discount their services for you. So I would assume that most graduate students would probably end up getting a discount if they use these clinics. And finally, the UAB School of Dentistry does offer comprehensive dental care, so lots of different services at discounted prices, but it is a bit of a drive to go all the way to Birmingham. And again, it would be dental students doing the work on you. Okay, so then just to mention vision insurance, kind of the same way. If you use a lot of services, it might be beneficial to get insurance, but if you just need eye exams every once in a while, it's probably less expensive just to do it yourself without insurance. Are there any questions about either of those, the dental or the vision insurance? Okay. So last tip is just be prepared. Read your insurance policy at the beginning of each year. So it's really boring. Nobody really likes to do it, but it's a good idea just to be prepared so that when you do need to use the services, you know what to expect. The other thing to remember is that there are a lot of different insurance companies and plans. So the physician and the facility usually don't know the limitations of your plan. They usually don't know which doctors are in and out of network. So it's always a good idea to be aware of it yourself to make sure that you're not stuck with the unexpected bills. The other thing is that insurance is a business, so they do make money. It's a good idea to be your own advocate and know what your rights are. And of course, the more informed you are, the better your chance of avoiding unexpected bills. So that's the presentation that we had today. At this time, I would like to open it up to questions or comments or lessons learned. Anybody that would like to share? We have one in the back.
Alright, so I just have one more comment because I actually, again, just found out about this. I think beginning January 1st, and these Trump administration's requirement, hospitals are actually, I don't think this isn't true for AUMC, but EAMC, for example, East Alabama. So, okay, that'll work. So I believe beginning January 1st, hospitals are actually required to have like general billing information for common like things that you would be billed for, like x-ray and things like that. Some of them will be a range, but actually all hospitals are supposed to. So if you look at their site, it may give you an idea of what maybe you're anticipating or what you may be looking at.
That's good information. So, a common problem is you go get a service, you go to a hospital and have a surgery. You don't know what your bill is going to be. You just don't. Like, they don't usually tell you. But what Elizabeth is saying, that they're starting to require hospitals to actually post a range of what to expect for your bills. So it might not necessarily save you money, but at least you'll kind of know what your bill is going to be, hopefully. So, anything else? Well, feel free to help yourself to more food or whatever is left at the back. Thank you.